Novavax, take a look at it, please. So those are the shorted stocks, more of them. All right, how about Novavax, up 5.6%? Yet they are working on a two-shot vaccine, not yet approved for emergency authorized use, but we have the CEO, Stanley Erck, with us this morning. Stanley, when might your two-shot vaccine be available here in the United States?
Well, the first place it's going to be available, I think, is going to be in the UK, which is where we did our phase 3 efficacy trial and showed very good results, not only against the original Wuhan strain, but also against the UK variant. We'll use those data in conjunction with data from a phase 3 trial in the US. Weeks ago that we finished enrollment of a 30,000 person trial in the US and are collecting data, efficacy data from that as we speak.
Now, it's a two-shot vaccine. Does it have to be stored at extremely low temperatures?
No, it's one of the advantages of our vaccine. It's very stable, and it gets stored at just standard refrigerated temperatures and can be shipped at those standard refrigerated temperatures globally.
How effective is your vaccine against, say, the South African variant?
Great. Well, let me give you a comparison because I think we have the only efficacy data for a vaccine against the three strains of vaccine. We've got the original, what's called Wuhan strain, and we have shown that we have 96% efficacy against that strain. And then in that same trial, we showed that against the UK strain, which is what is now circulating in the United States, we've shown 86% efficacy. So very good efficacy. And then when you get multiple deletions on it, we got efficacy in the 50% range.
So your audio was interrupted there. Yeah, I'm sorry, I just want to repeat this because your audio was interrupted slightly there, Stanley. Your South African efficacy rate is about 54%. That's what you said, I think, correct?
Right. That's right.
Okay.
So it works against all three strains, different levels.
Okay.
Go ahead.
Sorry about the delay here, Stanley. I do apologize. This is a question which I want to ask you. I'm not sure it's really in your wheelhouse. If we do get herd immunity, and I think we're talking about getting that herd immunity in America, April, maybe May, or even June. When we get it, is that a reason to lift all restrictions?
Yeah, so I think the CDC is, you're right, it's not in my wheelhouse, and the CDC is the group that opines on that, and I think we'd leave it up to them to advise on when restrictions would be lifted.
Okay, let's ignore when restrictions should be lifted, but are you looking at a situation where we might get herd immunity April or May in the United States this year?
Well, as I understand it, that immunity, the herd immunity that you're talking about, is you would start getting it around that time. And the question is what do we have herd immunity against, and what variant is circulated in the United States? The UK variant, as my understanding is, has started circulating within the last couple of months. It's picking up speed right now, and so the herd immunity will be available, but it'll be at a lower rate than might otherwise be seen against the original strain.
Last one, if I may, Stanley. If you get emergency authorization use, if you get it, how many doses can you put on the market in the next, say, 6 months?
Well, that's a great question. So a lot. We are manufacturing now. We've got 2 different manufacturing sites in the U.S., and we've got 10 manufacturing sites globally. And the expectation is that by roughly the third quarter of this year, that we would be at a manufacturing rate of roughly 150 million doses per month. And some of that will be in the U.S. and some of it will be outside the U.S.
That's remarkable news. Stanley Erck, thank you very much for joining us, sir. Novavax President and CEO. Vital information and real good stuff. Thank you, sir. We appreciate it.